So today I want to talk about health insurance with a pretty simple question going into it. And that question is, what the fuck are we doing? So I have been on an Obamacare plan for the last year that I have not gotten a federal tax credit for. It's a pretty decent plan here in New Mexico, and I've been paying $581 a month. I'm a 47-year-old dude. I don't smoke. I've cut way down on my drinking. I work out 4 to 5 times a week. I'm in pretty good shape. I eat good. I don't eat fast food. And I don't have kids, so that's not going to be an issue. And I have a vasectomy, so that's really not going to be an issue. However, I just yesterday went to check what the new price of this plan will be, and that's going to be $908 a month. So a $327 a month increase. And the reason for that is simple. Even though I don't get a tax subsidy from the federal government to help pay for health care, the Republicans in Congress and Donald Trump in the last budget, which was the reason the Democrats had the shutdown, decided not to fund the subsidy part of Obamacare. And what that means is this: health insurance works, or insurance in general works, because a lot of people buy into it thinking they might not need it every month, but if they do, they really need it. Think about car insurance. Everybody gets car insurance if you're on the road. You don't get in a car wreck every day, and so the cost is relatively low. But if you do get in a car wreck and you need the insurance, it's there for you. And so insurance companies can say, all these people are buying in at a low rate, so we can afford to pay off the few people who get in wrecks that need a lot of money. Health insurance is the same way. A lot of people, a lot of especially healthy people, buy into the insurance plan, and they don't go to see a doctor every day. They may not get cancer this year, and so they pay into it. And the insurance companies make a little bit of money on every person. But when you do fucking need it, they can then pay it out. Well, if people can't afford the subsidy to pay the monthly premiums, a lot of them might say, fuck it, I'm not going to get insurance anymore. And when that happens, the amount of people goes down. So the risk of the insurance companies having to pay for people that get cancer or get in a car wreck and need health insurance or whatever goes up. And that's the reason my insurance went up so much, is because they're seeing a lot less people that are going to get into the pool. So this fucking sucks, all right? And I see Trump wants to just give everybody money to buy insurance. Well, he wants to give everyone like a couple of grand a month. Guess what, Donald baby? That's only going to cover about 6 months of the difference of my plan. So what the fuck am I going to do for the next 6 months? I either get off insurance and I become one of those people, or I go down a level and I get less good insurance that I might be able to afford, but that won't pay as much going in. This is fucking stupid. No one should be scared in this country with all the money we have to go see a goddamn doctor. That's it.